Hello there. Good that you could join us.
Thank you for joining us today on this unique session. It's titled Pollinating Resilient High-Impact Mental Health Ecosystems in APAC and LATAM. Our session today is moderated by Chris Underhill, who leads and co-chairs the Global Mental Health Collaboration at Catalyst now. And we have our amazing speakers, Hannah Murillo, Beto Carvalho, and Gary Bilkin, which Chris will introduce in a bit. But before we start, I would like to share just a short video to welcome you all into the 5th and final day of our Catalyzing Change Week and to today's session.
Join us on a journey of discovery across 200 sessions and over 400 speakers from across the world. Sharing their vision, mission, innovations, and achievements. At Catalyzing Change Week, the largest convening of social innovators online. Connect, share, and learn from the best in the ecosystem. Brought to you by Catalyst Now.
Warm welcome, everyone. Just some housekeeping rules before we start. Please remember to keep your video on if possible. We would love to see your face and, see your reactions. Share your name and organization in the chat, perhaps, and connect with one another. Raise your hand if you have any questions or concerns, and feel free to put your questions in the chat. And most importantly, enjoy the session. I see some familiar faces here, but also many newcomers in which I would love to welcome and invite to join our movement. So if you are not yet a Catalyst member, please join us. Catalyst Now is a dynamic and fast-growing global movement of social entrepreneurs and innovators who are transforming systems and driving change. And we are trying to advance the achievement of the UN Sustainable Development Goals together. So do fill the membership form if you wish to join us. We are now more than 6,000 members and innovators who are collaborating to accelerate collective impact. And without further ado, I would like to pass it over to Chris Underhill to kick off the conversation. Chris, over to you.
Thank you so much, Lana. That's really nice to be here today with everybody. This feels as if we are like a family gathering. I see many people who I know on this session today, and people are very, very welcome. Just to remind people, we are recording the session because we want to be able to manage it later on and make sure that other people get to see it. I want to introduce the speakers, if I may. Hannah Murillo, welcome, welcome, welcome. Mental health practitioner and consultant based in the Philippines, and you are the executive director of the MLAC Institute. And of course, you are also a keen member of Catalyst. For example, you're the co-chair of Parenting and Social Entrepreneurship Collaboration, and of course, the Mental Health Collaboration. And in a minute, we're going to be celebrating the launch of the Asia Pacific Mental Health Collaboration, which we'll speak about in a minute. Beto Carvalho, very warm welcome to you. It's wonderful that you could be with us. And you're a social innovator and a catalytic ecosystem builder. That's a great phrase, a catalytic ecosystem builder. CEO at Soul Be Good Mental Health Venture Builder, co-founder of the Ventenas Mental Health Ecosystem, and co-founder of the Center for Research and Innovation in Mental Health at the University of Sao Paulo. You're a mentor and an advisory board member. Warm welcome, and we look forward to hearing from you very soon. And finally, and certainly not least, Gary Belkin, a psychiatrist who has held various policy positions and roles globally, including as a New York City Deputy Health Commissioner. I always think that meant that you were really the chief psychiatrist for New York. and what a role that was. He has brought to and learned from these roles to implement, to grow and make tangible these mental health ecosystems that Hannah and Bito are going to be building and talking about. And we obviously turn to you, Gary, with a recent focus on doing what in the context of climate change, resilience, because you're the founder of the nonprofit Billion Minds Institute, talking about mental health and climate change. So that, of course, is a wonderful speaker list today. We have, from the top of the hour to now, we have an hour to go. And so I want to immediately invite you, Hannah, to give us your talk and to introduce the whole question of the Asia-Pacific Mental Health Collaboration, which we're looking forward to joining.
Thank you so much, Chris. Maybe before I talk more in depth about the APAC or Asia Pacific Mental Health Collaboration, would you like to give us a brief background of what you founded and are co-chairing the Global Mental Health Collaboration?
Okay, yes, I'm happy to do that. So I find myself in the interesting position of being moderated as the moderator, which is really good.
Sorry, I flipped it.
No, that's fine,
Go
Hannah.
ahead.
So I am a social entrepreneur in the field of mental health. Have worked in that for many years. Some of the colleagues here today belong to the organization that I founded, Basic Needs, which has worked in the field of mental health since the year 2000 up to now. And as far as Catalyst is concerned, I founded and I'm now co-chair of the Mental Health Collaboration. I think that's enough about me. Let's tip it back to you, Hannah. Thank you, and thank you for your generosity.
Thank you so much. I'm Hannah Murillo, and my training is in psychology and not so much on social entrepreneurship. I wanted Chris to talk more about what he founded at Catalyst now, because I've learned so much from it, and I feel like, as he said earlier, like it's family. There's no judgment, there's no whatever, like the competitiveness or whatever you kind of experience on the field. It's just such a welcoming atmosphere, and I credit that to the environment that he's built at the Mental Health Collaboration Group. So at the Mental Health Collab, co-chaired by Chris, with other brilliant co-chairs, I learned that collaboration truly felt like sharing and support from the members toward the same goal. I did not have much background on social entrepreneurship, but I understand collaboration very well. I like the idea of learning with and from people, of feeling safe enough to be vulnerable, or say you don't know something yet, and people would be willing to listen non-judgmentally, or offer insights, or even solutions. So I stayed on and enjoyed the meetings and gatherings, which felt kind of therapeutic to me because it was somehow a break from the work routine, but I can still think about work in a different way, which I love doing. So with the experiences, you can maybe think of them as ways of working or best practices of other members, which were highlighted every month. I was feeling seen and heard amongst like-minded, passionate individuals, similarly leading their own organizations. I was given a chance even to share the work that we do at MLAC Institute among members. So in that kind of spirit, when I dove deeper into the Catalyst network, I found out that there were country-based and regional collaborations. I felt compelled to share the learnings I gained from the Global Mental Health Collaboration and the generous support I received. I'm telling you my personal and professional experience within the global network because it's also with this approachable and open environment that set the stage for the APAC Mental Health Collaboration, which we are formally launching now. And so being part of the core team at the APAC Regional Collaboration Movement called ASEAN Rising. It started out like that. sharing information to connect to the mental health collaboration, sharing like Lana's email or the email of the coordinator at Mental Health Collaboration, and just connecting people to other people and other organizations. I really love doing that, and sharing information as well on upcoming webinars. I really wanted people from my region, organizations, especially those who also felt like they were in the dark, to get to hear, the practices done globally and to feel inspired by them. So until such time, I was invited to lead the initiatives on mental health within the region. So building the ecosystem at the APAC region started quite organically. Sometimes I'd be there in the meetings to insert mental health check-in questions. I'd ask, the other leaders in the ASEAN Rising core group, how they are, how they really are, and then we'd all just talk about our work, our personal lives even. Or I'd also ask the group for mental health practices they have in their organizations, which they also generously shared. This became like a part of a webinar we did, that's also ASEAN based, and this was also in collaboration with other Catalyst Now members. And so we are like slowly but surely building on the foundation of the APAC Mental Health Collaboration to mainly, firstly, set a dedicated time and space that is friendly to our time zone, because I'm learning that real-time connection matters to the group. And secondly, to highlight and amplify APAC-based initiatives on mental health. So far, we have been enjoying challenging and insightful conversations. Some of the people who joined, the initial conversations are here actually. And, the insightful conversations on decolonizing practices and interventions and the concept of healing, as well as gender and cultural norms. So it's become like a welcome space for sometimes difficult conversations, but very important, relevant topics in the mental health realm and in the work that we do. So to end, still in keeping with the generosity and support, as well as the dynamic spirit of the Global Mental Health Collaboration Network, we hope in the APAC Mental Health Collaboration to amplify and reach more voices from the region towards our shared goal within the Catalyst Now network. So yeah, thank you everyone. And I hope that maybe those who can hear this can, drop by and sign in and become members of the APAC collaboration. Thank you for listening.
Thank you very much indeed, Hannah, and congratulations on getting this new collaboration moving.
Thank you, Chris.
It does take work. We are absolutely delighted that it's going to take place, and the mental health collaboration of Catalyst is really, really pleased that this initiative is taking place. As we know, the time zone for Asia Pacific has often meant that people have not been able to attend some of the webinars that we've been holding, and so that's important. We have quite a number of webinars online on YouTube, and we'll make sure that we send you a link for those before we finish the program, just in case that would be of interest. Now, Bito, without further ado, let's ask you to come in and make your presentation about the situation in Latin America. Over to you.
Thank you so much, Chris. Well, first of all, it's a pleasure to be here sharing this panel with all of you guys. And thank you so much, everyone, to be attending to this session. First of all, just an update in terms of the political situation that we are living and key dates and events that are happening now in November. So we have the COP coming in next week, in which we expect to have a very active incidents, especially in terms of financial mechanisms and commitments that could be supporting the Belém Health Action Plan, and to building the financial infrastructure, so we can definitely include mental health in all policies, but specifically into the adaptation negotiations. After the COP and almost link, it's the last day of COP is the first day of the G20. So we should be leveraging these discussions around mental health, and especially child, adolescents, and youth mental health. The expectations is for us to bring the commitments that we expect to have for COP in terms of climate finance negotiations, and how this could be leveraging into the G20. For some years now, we have been articulating this vision for high impact ecosystems in Brazil and LATAM, connecting with several networks engaged with this topic on mental health, climate, environment, and other topics that resonates with this proposal. I have some slides in an initiative that we are connecting Brazil, that I would like to be sharing with you, that resonates a little bit on, can you see my screen?
It's loading.
Yeah?
Yes,
There we
we
are.
can now.
Let me just see the presentation mode. So in Brazil, we have a very unique situation, actually. We have been impacted by climate events, and especially last year, we had a huge flood in the state of Rio Grande do Sul, which affected most of the cities of the state. So based on that, we got together with several organizations, including Gary, that is here in the call, in which we saw that we had to do something in order to support the incorporation of mental health services and mental health access through these communities. So the key aspect that we want to be raising here is that resilience system begins with resilience minds. So we want to destigmatize mental health as just a health issue, but as an infrastructure to support the communities to overcome the disasters that unfortunately are becoming more and more frequent for us. So we do have a mental health crisis throughout the world, especially for children, adolescents, and youth. We have several data indicating that this problem is not getting better. Unfortunately, it's getting worse, especially when we think about the suicides between young people and youth. Unfortunately, we have a tendency of increase of suicides, which demonstrates that as a society, the way that we are doing things, unfortunately, we are failing. This is also true for Brazil. We have a huge impact in terms of the mental health, not just in terms of the social impacts, but also the economic impacts. It has been affecting. Sorry?
No, continue.
Yeah. And this is definitely one aspect that we intend to be engaging, having this intersectoral approach to have mental health covered into all policies, connecting healthcare to education, to social protection. And this is how we are intending to build that, because it is not just affecting socially, it's not just affecting the communities, but also it's affecting the economy. So we have a huge impact in terms of mental health into our economy, and how this is it's affecting our national gross product intake. So one aspect that we are raising in this sense is to foster these high impact ecosystems, to promote psychological resilience and support the communities in order to face the challenge that more and more often we should be having in place. So the opportunity that we are escalating here in Brazil is to effectively implement and test and validate these high impact ecosystem models in which we expect to have this dynamic cooperation between different sectors, but most importantly, building the solution together with the communities. So having this approach is the only way that we foresee that to have the truly commitment from the communities, and moreover, to building mechanisms in which we could be reducing the dependence for external funding and promoting a regenerative local economy in order to have these ideas and these proposals to be sustainable. So what we have been designing here in Brazil is actually to leverage some innovative financing mechanisms to make that happen. We don't only depend on public budget, but also engaging the private sector and the philanthropic sector to start building mechanisms in which we can converge the inflow of capital to build these resources. One example is a project that we approved here through SoBeGood. It's called Arte na Mente, Art in Mind, which is a tax deduction public policy dedicated for arts, and we adapted the implementation of mental health, social development programs integrated to art. So companies can support us, dedicating part of the taxes that they would be paying to the government to be supporting these programs in schools. We are also working with the UN Youth Office on this new mental health flagship that is being launched actually this week in Doha, and we expect to have it published in the upcoming weeks. And what we are effectively promoting in this model is to strengthen what we call the colmeia. The colmeia, in English, it's the hive. It's a social infrastructure in which we expect to have these intergenerational groups of local communities members, integrating child, adolescents, youths, and elders. The key role of the colmeia is actually to rethink the local needs and upon the local capacities, design, implement, and improve mental health care paths that could be integrating schools, social protection, health, and other areas that are important for that community to be thriving. We do have, and this is the important aspect for us, we do have a series of organizations that have been endorsing the construction of this model. And we do believe that there is no way that we can build this alone. So we have to be connecting, especially with governments, to support them into this roadmap implementation, but also connecting organizations such as Billion Minds that have this expertise in fostering psychological resilience, and also connecting these fronts to the implementation of an observatory. So we could design indicators that could be supporting not just implementation, but also the access to funding and the monitor of these programs. So just a quick presentation on how we are evaluating, how we are implementing. Actually, we're going to be starting next year with 3 schools in the region of Porto Alegre to validate this model. So we intend to culturally adapt the roadmap Care for Change that COP Square and Billion Minds design in terms of articulating these local sectors and how can we be engaging them to build and to foster these systems. We should also be culturally adapting the multi-sector mental health psychological support assessment toolkit, which provides this interconnection between these different areas and how can we support the governments to foster resilient systems. And last but not least, mobilizing these COMEA networks in order to have these local capacities built and ready in place. As I mentioned, this will be culminating into a national observatory for resilience and mental health, articulating together with Billion Minds, Corp Square, and a few universities here in Brazil. So we can have this, not just this data, but also the indicators that we'll be leveraging the construction of this implementation. Our role actually is not to reinvent the wheel, so we are intending to adapt and implement locally best buys that are currently already proved to be effective, but of course that we need to be take into consideration the local needs and also the local capacities of these communities. As a next step, we intend to act on the economy and build this self-sustainable financing model to reduce the need of external capital, but we do need a first input in terms of resources, so we can, together with the communities, evaluating these regenerative economy aspects that we should be incorporating in order to reduce this dependence for external capital. Last but not least, the objective of the COMEA is also to generate local data, but have this advocacy incidents and to adapt public policies, resilience and adaptation plans, to be more prepared and to incorporate mental health into all policies. I think that's from my side. I don't want to take more.
No, that's great.
And I pass the ball to Gary, which has been an amazing mentor, supporter, and helping us to design this model, but also to engage key stakeholders for us to move forward. Thank you so much, Chris.
No, that's fine. And thank you, Beto. And we look forward to your talk, Gary. Do you want to load up your slide?
Lana, actually, I'm going to take it. I'm going to do it from here. I'm going to share a screen and take it from here.
That's fine. Go for it.
If
So
I
you're
know
very
how,
welcome.
where do I do that?
If you need Lana to do it, she can.
I'm hoping it lets me. Yes. Okay. Can you see my?
If you can put it onto presentation mode, that'd be great.
Yep. Great.
Welcome, Gary. Over to you.
Thank you, and greetings, everybody, and a bit of a nice handoff, and Hannah, congratulations. I really want to pick up where Beto left off on the pieces that he was describing to put together to actually implement this idea of mental health ecologies, which has been going by so many names: mental health in all policies. You know, the idea that mental health has to be in the water, both in how we deliver it, but also in the impact that it has. That if the data says that it's, you know, the key foundations are a key factor in all sorts of social outcomes, then why aren't we both growing mental health and repairing mental illness and distress and so forth in ways that intentionally strengthen those connections that it has and achieve those, do mental health in a way that helps achieve those social outcomes. So that's an idea that is becoming more normal, but how do we implement it? Because it's a different kind of implementing. It's not just building clinics and training clinicians. And so I'll talk to you a little bit about how I've been trying to answer that question with people, with some people on this call, with Beto and a project that he brought up that I'll also touch on. And I've been focusing now really on doing it this way in the climate space, which is getting much more attention. And so how do you integrate psychological resilience into climate resilience? Because I think we have to have an ecological model and implement that way everywhere, just as the new normal of how we think about mental health systems, but especially in the climate context. And so I'm going to talk a bit about how we've been putting to practice a strategy that came out of a roadmap for care and change, which Beto also mentioned. This was a project that it was in collaboration with the UNFCCC Race to Resilience and its partners. So the Race to Resilience is a massive mobilization of effort to try to build local capacity to do climate adaptation in the most affected parts of the world. And that strategy of the Race to Resilience and the broader civic mobilization for climate adaptation was really first articulated in the Sharm el-Sheikh Adaptation Agenda at COP27, I think it was. And what we launched there was an effort we were doing over the prior year of trying to develop a strategy, an implementation strategy for how you could integrate, how that whole mobilization of effort for climate resilience and building capacity for it could also at the same time and integral to it develop capacity for what we were calling psychological resilience. And so this, if you go to our website at billion.org, this roadmap strategy is still there. And what's great is not only did we get a strategy, we got hundreds of organizations that put into it, UN agencies, global NGOs, et cetera. But a lot of them wanted to do it. And so that led to a little bit what I'm going to talk to you about of what we call early adopter efforts, which were big climate actors. So they were coming together to do climate adaptation at some scale that we came up with implementing models for them to integrate the work of psychological resilience within that work. It wasn't a layer, it wasn't another lane. It was their owning mental health in a way that made sense to them for their climate objectives. So it was really started, it originated with this idea, okay, we're going to build mental health in a way that is helping people do other things. And here's my 10-year-old son going to school. Yes, I will. Very good. Okay, lunch money.
Well, it shows.
And so what I brought to that work was something that I started to think about and do when I was New York City Mental Health Commissioner. Some of you have seen this map, where it was my first chance to really have to think at this scale. Okay, we want mental health to happen in churches and community centers and job training programs and shelters for homeless people. How do we actually do it? How do we relocate? How do we push the real estate for mental health, so to speak, everywhere? And so this is a map in New York City that reflects a whole bunch of efforts that we set up where we were training mostly non-professionals in daycare centers, in job training programs, in our schools, in all sorts of other social spaces to do evidence-based, certain forms of evidence-based support and interventions. And it resulted in this map. I just wanted you to take away from this map what's possible in terms of really widely distributing the work and the real estate of mental health work. And so think of this as a visible result of thinking of how do we create an ecosystem. But that got me to think further than, well, how do you implement it? You know, how do you get those dots to be more than the sum of its parts, to learn from each other, to reach out and evolve, to impact the communities and neighborhoods that they're actually in, to replicate what they're doing in other places? How do you really make it into an ecology, a working, self-learning, growing ecology? And so I mentioned the early adopters that we had brought together that resulted from the roadmap process. And it was quite a mix of big NGOs, BRAC, Slum Dwellers International. It was UN organizations. It was funders, it was finance institutions, it was policy institutions that all had in common whatever their climate work was, whether it was policymaking or micro-lending or with, for example, Slum Dwellers International, informal settlement, material infrastructure strengthening, whatever they were doing climate adaptation-wise, how within that activity do we bring a mental health impact capacity to them that goes through the way they were doing those other things. So for example, we had that led to some real on-the-ground efforts, like with Slum Dwellers International. We asked them, what's hard about your climate work? And they said, what's hard about it is we depend on youth for it. In Nairobi, there's a youth cadre of 1,300 climate action groups members and our youth are falling apart. Is there a way for these groups to also be emotional support groups, to train youth peer emotional support counselors and leaders? And I said, absolutely, you can do that. There are ways to do that. And so we brought with them the partners to help them use their existing way of mobilizing people. For 30 years, they've been organizing communities from the ground up to identify problems and design solutions and advocate and implement them. So we just put into that social machinery that they already had and already mobilized around climate adaptation to now pick up this new task of training, supporting, and extending a youth peer support network. Similarly with BRAC, they were doing an effort, how do we get cities to plan for in-country migration from climate change, and to also include in that planning capacity a community mental health component. So we just asked them, well, how are you mobilizing those communities to do climate adaptive work? We'll work through the same people. We'll train them again in terms of task shared, mental health skills, et cetera. And so there were various versions of this. And we've also found in this journey a real interest in the climate resilience finance community. I have to say, often I've had an easier conversation explaining and persuading this idea to climate finance folks than people who lead standard conventional clinical mental health systems, who get right away, oh, I'm a micro lender. So this micro lending group, Scale for Resilience, is works with and helps climate micro lenders. So for smallholder farmers to get different seed stock or to do an irrigation project. They're saying, well, yeah, if the return on investment or the ability to pay back my investment, let alone use it well, is going to really be impacted if they're depressed. So they get that right away. And so more and more of them are getting that right away. It hasn't been that easy, but it's really been interesting how that has been accelerating as a point of view in just the last couple of years. And so what I was very curious about, okay, how are you contacting your lenders? And often they do it very hands-on. And so we had credit unions who were meeting potential loan recipients in person, going to their home, et cetera. And they said, can we have mental health skills? Could we ask them questions about whether they're depressed or not? And then guide them to something. So in the most unexpected places, a bank, to be a leading edge of doing community mental health. And various funders were now doing a report for the World Bank, making this case that psychological resilience should be part of climate resilience and therefore supported by climate resilience finance. And we hope to get that out in the world soon, especially with the Vellum Health Action Plan, and it's hoped for real substantive content on mental health, which it's looking like it will have. The case is already made. Now it's really about, okay, let's pay for it, let's design it, let's guide countries and local governments and NGOs globally about how to do it. So the last learning that I want to share, which is things I'm bringing to this project that I was talking about and to those early adopters, is great. We've made the case that mental health has to be in the water. We have to create those maps of dots. Okay. How do we not just propagate a dot at a time? How do we really integrate them as a system? And I think it really means we as a mental health community have to rethink what a mental health system looks like, and that its center is not a clinic. The center is all these other social spaces with the clinic and other anchor capacity is supporting those many dots of social spaces to be able to do front-end work for mental health, and the clinics backing them up, training, coaching, supporting others ways, and also backing them up clinically when necessary. So we have a working hypothesis going. I can't say this is a secret formula, but it's trying to take the thinking that I just said in an operational way. So we broke out, and this is in the roadmap report, we said, you know, for those dots to work, for those non-mental health places to be mental health leaders and providers, what roles are needed for that to happen? So functions have to happen. So we broke out these 4 functions. So some kind of formal care, there's some kind of intervention, there's somebody doing something with somebody else that's going on, which is a task skill that has to be learned, et cetera. There's monitoring and improvement, that they're doing it well. And not only individually, but those clusters of work are doing it well. So dashboarding, you know, some kind of monitoring and improvement. There's training and coaching for those skills to do that care. And by the way, by this, I'm sorry, I meant there's formal care. So there has to be that formal care backup. But there also has to be that front-end task shared, non-clinicians doing care, and they have to be trained and coached and supported for that. And then there's just a process of planning and logistics and aim setting and making those pieces come together. Training multiple places in Nairobi. That's a logistical planning effort, and so that coordinating work. And so we found that a lot of folks, a lot of those organizations we were working with, like BRAC, like Slum Dwellers, could do a lot of these things. They know how to do planning and implementation. They have a real machinery for doing skill training and coaching for residents, although for different things, but they have a machinery for it. There are formal care partners that can back them up and train them. So what we did for each of these big on-the-ground efforts is we found where the actual owner of it, the BRAC or the SDI, needed one of these functions, they needed to be filled in by a partner so that all these roles were covered. If the dot itself couldn't do it, okay, who do we have to bring in to help fill in these roles? And basically, there are a whole bunch of institutions out there everywhere that can fill them in. Universities, an array of NGOs, health systems, local government, to name but a few. And you can find those pretty much everywhere. So what our hypothesis is that we could fill the functions. If one of these circles is this network across Nairobi with, for 1,300 youth, what we have to put in that circle are those 4 capabilities. And let's find for that circle, for SDI in that neighborhood, for example, let's find for that circle the partners that they need to fill in those 4 functions. And some of them, the NGO itself that's really owning this work can do. And then others, we need to bring in maybe a different NGO or the health system or the local government. But what gets really interesting is if you want to propagate 1,000 NGOs or 1,000 locations that Slum Dwellers International is to propagate these circles. And each locality may have different partners that fill in those 4 helping functions, but those 4 helping functions are the same. It's just filling in who is there that can help be the anchor partner to the work. And what's great also is there's ways of learning across, these are the dark lines, there are ways of learning across local governments. So you have local governments, these can be 3 different cities in Kenya, let's say, where a local government is being a partner, but in a different way. Here they're doing monitoring improvement support. Here they're doing content skill building, right? So there's now a learning among anchor types to really get good at, how can local government has a lot of ways it can support these ecosystems. And they can learn that because they're also, if we put enough on the ground, they among them as a group are showing that diversity. And learning can also happen across these functions and so on. And so to put all that together, I think we have the thinking, and I think we're starting to put on the ground as a field of global mental health, stuff we're doing with these early adopters, and we're growing those early adopters, the ecosystems that you just heard about that can build these maps, but can also build ways that there's a replicable format for supporting them to grow, and models of learning that they can sustain their own contextuality and specificity, but learn across each other. And for that, we're looking at quality improvement methods more than usual evaluation sorts of methods. And if people are not familiar with yet, I would Google and look at the method of learning collaboratives, improvement learning collaboratives. Because what they do is, if let's say there's a particular dot here that can do a very simple process of a theory of change, where using, in this case, a tool called the driver diagram. The left-hand side is a stated aim to enable youth to complete their climate projects, let's say. So that's the local goal. It's not necessarily a mental health goal. It's their social goal that they're looking at. And then they go back and say, okay, what has to happen? What's a primary driver for that to happen? And then for each of those primary drivers, well, one driver may be, well, they need, to give mental health support. Okay, well, then they go back to what's a driver for that? Well, they need access to somebody who can do it. And eventually you get to drivers that you can start working on tomorrow. And when you've got hundreds of these clusters that are trying to do similar goals, climate outcome goals in this case, but coming up with different theories of change of how they're going to get there and with what they need to do that, then you have real learning when they all come together. So we're trying to take that to scale with our early adopters to grow, being able to do that, to take clustered maps and create an ecosystem of learning and knowledge sharing that we're calling the Global Resilience Observatory, which we're just launched with at the Clinton Global Initiative as one of their first real action commitments of their Coalition for Mental Health Investment, to put that map idea and that learning and implementation template for growing idea and technical assistance for that and knowledge exchange for that in a global open source scaffolding called this observatory. And so we're really looking forward to making that happen. And especially with Beta, which we've started trying to make that happen and create a global hub. And Hannah, when you're ready, it'd be great to have a regional hub where you are, and looking forward to doing all of that. Thank you.
Thank you, Gary. That was extremely comprehensive and very interesting. So what we've had today are, three very different presentations, which I think have all been nourishing and really helpful from our point of view as people interested in the field of global mental health, which I think has been great. Lana, I just need to check with you. Are you happy to take signs of interest from people who would like to know more about Hannah and her mental health collaboration is that going to work?
Absolutely. I was going to share the call to action.
Yep, do so.
So
Please.
let me share my screen just quickly. I wanted to thank you all. This has been a really, really special session, and I wanted to congratulate Hannah for officially launching the APAC Asia Pacific Mental Health Collaboration and leading it. And Beto and Gary for the amazing and wonderful work that you have been doing and sharing as well. If you think this is relevant for you, and if you're interested in shaping and joining the APAC Mental Health Collaboration, please join us through the portal. I will put the link now in the chat, or reach out directly to me. My email is lana@catalystnow.net. And if you're also interested in what Gary and Beto are doing, feel free to contact them directly. Beto has also put his email in the chat. And we are also planning with Beto to launch a masterclass that is specifically on mental health in LATAM. So stay tuned. And if you're also interested in co-creating that with us, let us know. We would love to have your expertise and knowledge. And finally, if you are not yet part of the global mental health collaboration and ecosystem at Catalyst, which I doubt, but if any of you are new here, please join us, and if you so that you can also attend our future webinars. We do them sometimes on a monthly basis, and you can also check our previous webinars on our YouTube channel. So I will put the links in the chat now, if you can give me a second.
Great, that was really helpful. So this is very much about resourcing, and Jacob, you have given us a masterclass in how you resource as we have been going through this presentations in the chat. So thank you very much, Jacob, for your support, by the way. And
should I end this session, or you have any final words, any thoughts, any reflections that you want to share?
I will just bring it to an end.
Okay.
Just putting on the chat also a podcast, which a friend of mine, Christy, and I are running at the moment in the field of global mental health. Yeah, it just really is important, I think, for us as a group to say thank you very much indeed to you, Hannah, and congratulations on the launch of the new collaboration. To you, Beta, we really appreciate the work that you're doing, particularly amongst young people, which is not only important, but it's also significant in the reach that you're providing. It's not a small project. This is quite a big program, and that's what's necessary, actually. So that's important. So thank you so much for that. And Gary, thank you for taking us on a journey, really, and giving us a sense of how mental health, global mental health work can work on the one hand globally, but on the other hand become really important at many local different positions, so that you get to the point where if you ask yourself the question, is there something I can do in the field of mental health? The answer is yes. It's not at all the case that we have to leave it to specialists to do in some far distant organization which we don't know how to contact and so on. We can definitely be also involved. Sachin Chowdhury, who's with us, has created a marvelous app for that particular purpose, and is working, and he has put his contacts also on the chat, which is great. So we just want to really thank each of our speakers in turn. Thank you for coming to this meeting, which we very much appreciate your attendance. And we are committed as Catalyst now, and as the Mental Health Collaboration of Catalyst now, to make sure that we keep these connections going and that we keep supporting this incredibly important work. Thank you very much. And thank you, Lana, for being our support today.
Thank you so much. Just give me a moment. I also want to shout out a special thanks to our attendees today, of course, and then for our partners and ecosystem supporters and partners. And I would like to invite you all to think of the biggest take-home message that you took from this session and to share it with us on social media and tag the panelists, so that we can keep the momentum and connect with one another, because this is all about, connections and building these strong relationships.